Now next is presentation of a first seizure. In this, Miss Ahmad, she has seizure, and she was brought to the hospital and she was given diazepam. Now she is feeling better. CT scan was done, which was normal, and the parents wants to know about her. And your tasks are to explain to the patient about seizures which she had and how she is going to be managed, and find out up to which extent she wants her parents to be informed. Okay, so now how you will start. Okay, hello, good morning. I'm Dr. Ace, one of the doctor in the medical ward. Are you Miss Ahmed? Okay. I'm here to discuss with you about your medical condition and what we can do further. Okay. Now I check the understanding. So for this, it's preferable that I see you in the private first before bringing your parents in, because I may ask you some important questions which may be some sensitive issues like drugs and alcohol, which you may not want your parents to know about. Okay, so before I proceed further, will you tell me that how are you feeling now, and do you remember what happened? Now whatever she will say, just listen. Okay, then tell her that recent activity was a seizure. And do you know what do you mean, what do you mean by the do you know what what is seizure, what you understand by it? Okay, and then tell her that doctors are quite confident about their diagnosis. Then become silent and see how he reacts. Then take a little history, asking about febrile convulsion in the childhood, any medical history, any drug history, or any stress related issues in her life. And then tell her that this is a good news, that single seizure activity, it does not equate to the diagnosis of epilepsy. Okay, if she may ask what is epilepsy, you can tell that it is disordered electrical activity in the brain causing recurrent fits. However, I will book your appointment. I will give you an appointment in the outdoor for a test to see the electrical activity of the brain, and it is a test which is called EEG. Okay, and she may ask you that start the treatment and to prevent the seizure. Then tell her that okay, I appreciate your concern. But it is not usual practice to start patients on treatment following a single fits, um, because of chances of recurrence, especially if it doesn't have any risk factor and it is indeterminate and it is variable. If still she wants to know, and or if still she insists no start medication, then tell her that there are different type of anti-epileptic treatments available, but there are side effects related, and as you are young, you may plan for your baby, then it can adversely affect your baby. Like this you have to tell. Okay, and then ask, are you driving? Then tell her there is driving restriction, and tell her about DVLA guidelines, that she is not allowed to drive for 1 year after an unprovoked fits. These DVLA guidelines, please read from Cases for Paces. Okay, there it is given nicely. You don't have to do the details of DVLA guidelines, but you should know whatever is given in the Cases for Paces. Please do it from there. And then tell her about insurance policies, that it has also become invalid. And then again, whatever questions she asks, please, whatever are her concerns, kindly manage it. And also you can advise her that avoid taking risk taking behaviors, like if she used to go gym, doing swimming, or so she should avoid it. If she goes to the bathroom, try to avoid locking door from inside. And like these things you have to tell her, and whatever her concerns, kindly address it and do the end as I told you, that patient recap, you recap, check understanding, offer helps, follow up arrangements. Okay, and for driving guidelines, tell her that you need to inform the DVLA, and if she is bound to involve and she will not do, then we will pursue the patient relatives that to pursue her to inform the DVLA. If still she is continue to drive, and not informing a DVLA, then we can inform her that we are bound to inform the DVLA by ourselves, but we will tell her before we are going to inform the DVLA. But this driving issue related communication skill, it will come ahead, and there we will discuss in detail that how to deal with such patients. And then in the end, ask permission from her that how much you want your parents to be informed. Okay. Please like, share and subscribe my YouTube channel for more videos. Thank you.